Hi everyone, this is our presentation on infants age 0 to 24 months. Today we will be discussing the topic of infants who are maltreated by mothers that are diagnosed with postpartum syndromes and disorders. Part 1 of this presentation describes the incidence and clinical perspectives on victimology. Maternal depression impairs parenting skills and can affect the amount of attention given to the baby. There is also impaired judgment in regards to child supervision for safety and health management. Frequently, because of the mother's guilt about having symptoms of anxiety and depression when motherhood is expected to be joyful, they often do not report these feelings to their doctors, which can cause serious consequences for the infant, such as poor cognitive functioning, emotional maladjustment, and behavioral inhibitions. These infants also display impaired social interactions. Language acquisition depends on the number of words used by the family while playing and interacting with the infant. These activities may occur less frequently in a family of a depressed mother. As a result of this, these infants are less likely to exhibit a strong and healthy attachment to their mother. These infants often display negative outcomes in response to their mother's depression, such as sleep problems, temperamental problems, and excessive crying. So, what is infanticide? Infanticide is the crime of killing a child within a year of birth. Mothers with postpartum psychosis are prone to commit this crime due to their exacerbation in symptoms, hallucinations, or the stressors of caring over a new infant. Another motivation is revenge against the father, or the infant is just purely unwanted. Postpartum psychosis occurs in 1 out of 500 mothers with rapid onset in the first 2 to 4 weeks after the infant is born. In the United States, the homicide rate for children up to 1 year old is 8 per 100,000. Neonaticide is the killing of a newborn infant within 24 hours of birth. Between 16 and 29% of mothers who kill their children also kill themselves. The following is a case example. A 22-year-old adult female was found in a church arguing that the infant was the new Jesus Christ and people were trying to kill them. She had auditory hallucinations, she heard voices making rude remarks about her inability to look after the baby, and she was exhausted from lack of sleep. Consequently, she was diagnosed with postpartum psychosis and was admitted to a psychiatric hospital. At 18 months, the toddler showed a delay in reaching developmental milestones that included physical, mental, social, and communication skills. When an antidepressant is started in a woman after delivery, it is recommended to start with low doses and to measure the dose up slowly while also monitoring the infant for adverse effects. Possible adverse effects in breastfeeding infants include irritability, sedation, poor weight gain, or a change in feeding patterns. Benzodiazepines, which are sometimes administered to patients with neurotic depression and postpartum depression, cause serious risks to the newborn, which include lethargy and impairing temperature regulation. The only known current mother-baby unit in the United States is a partial psychiatric hospital that includes observation, the promotion and modeling of a healthy maternal-child relationship, and the absence of breastfeeding disruption. Part 2 of our presentation goes into the forensic psychology of the perpetrators of infant maltreatment. When it comes to postpartum disorders, many disorders and syndromes fall under the collective umbrella for postpartum illnesses. These postpartum disorders include baby blues, postpartum depression, postpartum anxiety, and postpartum psychosis. Postpartum anxiety can be further broken down into generalized anxiety disorder, postpartum obsessive compulsive disorder, and postpartum panic disorder. Postpartum psychosis can include schizophrenia, bipolar disorder, schizoaffective disorders, depression with psychotic symptoms, and brief psychotic disorders. Any of these illnesses can appear during the postpartum period, which is the first 12 months after childbirth. Symptoms of postpartum illnesses include depressed mood, loss of interest or pleasure in activities, sleep and appetite disturbances, loss of energy, feelings of guilt or worthlessness, anxiety, irritability, diminished concentration, and thoughts of suicide. In addition to these symptoms, postpartum psychosis symptoms may also include agitation, restlessness, withdrawal, cognitive disturbances, reality distortions such as hallucinations and delusions, and abnormal thoughts directed towards the baby, such as the baby is in danger of being hurt or the baby is evil. Unfortunately, there are many negative consequences relating to postpartum illnesses. Mothers with higher levels of depressive symptoms were more likely to demonstrate an increased prevalence of suicidal ideations. They were also more likely to report having thoughts of self harm and could imagine portraying acts of infanticide. These mothers have an increased difficulty with bonding and or forming an emotional attachment with their babies. Excessive worrying related to postpartum depression, fear of being abusive, and bonding difficulty are primary predictors of child abuse. Postpartum illnesses may also have a significant effect on a child's weight and length. Infants may gain less weight and their growth might be stunted due to the malnourishment stemming from maternal neglect. Mothers with postpartum schizophrenia have poorer parenting outcomes such as caring for their infant and their emotional responses. They were also perceived to be at a greater risk of harming their infants. In serious cases of postpartum psychosis, increased hostility towards the child and child related delusions may attribute to serious harm being done to the child, and in rare cases, infanticide may occur. Mothers who suffer from postpartum psychosis that brings about cognitive symptoms like confusion, strange beliefs, or delusions may have substantial problems with mobilizing the cognitive resources necessary for parenting, which in turn may lead to neglect and or child abuse. When it comes to the interactions between a mother and her child, women with depressive symptoms showed less closeness, warmth, and sensitivity and had a lower level of emotional availability or involvement towards their infants. Negative mother child interactions can be detrimental to the overall development of the infant, including physically, emotionally, behaviorally, and cognitively. Depressed mothers appear to be more likely to engage in less healthy and potentially dangerous practices with their infant, including not using a car seat, not placing their infant in the back to sleep position, and not having a working smoke alarm in the home. Low levels of nurturance and high levels of discipline were also associated with postnatal depression. Depressed mothers have a significantly higher risk for spanking their child, about 4.2 times greater. Infants and all children are meant to be helped, guided, and loved, but unfortunately, this is not always the case. When children are maltreated, the perpetrators must face legal and criminal implications for their actions. Even when a mother is diagnosed with a postpartum syndrome or disorder, they still have to face legal and criminal justice implications for the wrongful actions they commit. The interface between criminal law and the field of psychiatry has manifested predominantly with reference to the defense of pathological criminal incapacity, more commonly referred to as the insanity defense. Postpartum depression defense, also known as PPDD, is a form of the insanity defense often used when mothers harm their children. The reality is that mothers who kill their infants often perform these criminal acts as a result of their suffering from serious mental disorders, often unknown to themselves or to others around them. Courts have determined that the insanity defenses, including PPDD, can be used as legitimate criminal defenses. In order to establish the defense of pathological criminal incapacity, It has to be proven that the accused, at the time of committing the offense, suffered from a mental illness or mental defect which rendered him or her incapable of appreciating the nature of their crime in accordance with such appreciation of wrongfulness. There is one very well-known case that demonstrates how the effects of postpartum psychosis can have deadly consequences. That case is of Andrea Yates. After the birth of Andrea's third child, she was having thoughts of Satan and believed that those around her were Satan. After the birth of her fifth child, things got worse. Her family described her behavior as catatonic. On June 20, 2001, Yates drowned all five of her children in the bathtub and subsequently laid them on a bed. At first, 12 jurors did not accept her insanity plea and found her guilty of capital murder. But after a retrial, she was found not guilty by reason of insanity and sentenced to life at a state mental hospital where she remains to this day. The evidence presented at each trial in cases like these are very important for the verdicts. Jury composition is also important, specifically the jurors' individual differences, which include cognitive processing style, moral disengagement, and gender, might affect an individual's perceptions and reactions. Many courts allow women with postpartum illnesses to assert the insanity defense to explain for their actions. States differ in the tests they use to determine insanity. These tests include the McNaughton rule, the Durham test, and the Model Penal Code test. Women who have used postpartum depression as a basis for the insanity defense have received outcomes ranging from acquittal to the death penalty. It might be difficult for jurors to show leniency towards mothers who commit such an act, and even more difficult to find them legally not guilty. Although jurors are supposed to be impartial, pre-existing attitudes and biases can influence how they attend to, process, and interpret evidence, resulting in biased judgments. Motherhood is an extremely rewarding job, but also a very difficult one. When factoring in a postpartum illness to that equation, it makes an already demanding job seem nearly impossible. To quote the former First Lady Michelle Obama, "At the root of this dilemma is the way we view mental health in this country. When it comes to mental health conditions, we often treat them differently from other diseases like cancer, diabetes, or asthma, and that makes no sense. Whether an illness affects your heart, your leg, or your brain, it's still an illness and there should be no distinction." Thank you for watching our presentation, and we hoped that you enjoyed it.